What to expect during a specialty claim exam, such as your ophthalmological, dental and oral, or auditory exam. If you're a veteran who has a disability due to your military service, you may decide to submit a disability claim with VA. Certain disability claims require you to see a specialty doctor for your claim exam. This includes exams for ophthalmological, dental, and auditory claims. An ophthalmological disability is one where problems with your eyes, such as dryness, redness, discharge, or other disabilities, cause you pain or trouble with your vision. A dental and oral disability is one that causes pain, stiffness, dysfunction, burning, inflammation, and growths in your mouth, or a loss of your lips, cheeks, tongue, teeth, gums, and salivary glands. An auditory disability is one that impairs your hearing. If you've submitted a claim to VA for one of these types of disabilities, you may be asked to come in for a claim exam, also sometimes called a compensation and pension or C&P exam. Claim exams help VA gather or confirm medical information needed to make a decision on your claim. What happens during your exam will depend on what medical evidence is already included in your claim application, such as your medical records. Exams can be different for everyone. Exams may only last a few minutes or may take longer. Remember, the length of your exam is based on what additional information VA needs. The length of your exam is not a determining factor in your claim decision. Wear loose, comfortable clothing to your exam in case you need to move around, and be sure to follow any instructions you may have received about your exam. Don't be afraid to ask the examiner what will happen during your exam. For the most part, the examiner may ask you a series of questions about your condition, like how it affects your daily life and job, current medications, and any treatments or surgeries you've had. The examiner is asking you specific questions for a reason. They relate to what's in your file and VA's rating criteria. Answer the questions as best you can. The examiner may also need to do a physical exam or perform a few tests. If needed, a separate appointment may be scheduled for some of the tests. Ophthalmological, dental and oral, and audiological disabilities all require specialist exams. For example, if you've submitted an ophthalmological claim, you will only be seen by an eye doctor for your claim exam. During your ophthalmological exam, be prepared for the examiner to potentially check the affected areas by looking into your eye for any discoloration, drainage problems, swelling, floaters, or other irregularities. They may also perform a puffer test to check your risk for glaucoma, where a short puff of air is aimed at your eye to test the pressure in your eyes. If you submit a disability claim for a dental or oral disability, you will be scheduled with a VA dentist or a VA partner dentist for your claim exam. For dental and oral exams, be prepared for the examiner to potentially examine your teeth and gums, check for missing teeth, or ask you to perform everyday tasks like chewing, puckering your lips, or moving your jaw around. For audiological exams, you will be examined by an audiologist. To evaluate your hearing, the examiner may perform an audiogram, where different sound frequencies are played and you notify the examiner which sounds you can hear. VA recommends you do the following for your hearing exam. Try to avoid exposure to loud noises before your exam, such as anything louder than a vacuum cleaner, that could cause ringing in your ears. Let the examiner know if you're experiencing any type of illness such as a head cold or the flu that can cause mucus buildup in your ears. For all specialist exams, be sure to let the examiner know if you feel uncomfortable in any way. Your safety comes first. Remember, your exam could last 15 minutes or an hour or more, but no matter how long or short it is, the examiner is getting exactly the information they need. Once your exam report is complete, it is sent to a VA rating specialist who will use it along with other information you've submitted in your application to rate your claim. Don't forget, examiners do not make a decision on your claim. They're one part of a larger VA team working with you to process your claim. Any specific questions about your claim should be directed to your local VA regional office or accredited Veterans Service officer. VA is committed to ensuring you know what happens during the claim process and that your VA claim experience goes as smoothly as possible. Have more questions about the VA claim exam? Go to the website listed here or search VA claim exam on VA's website.